Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'honorable Dorothy Shephard, ministre de la Santé. Good afternoon, everyone, and welcome to today's COVID-19 briefing. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Bon après-midi à toutes et à tous. Good afternoon, everyone. With each passing day, more New Brunswickers are being vaccinated against the COVID-19 virus. More than 150,000 of us, nearly 1/4 of our population, have now received at least one dose of the vaccine, and this is very good news for our province. Yet we are continuing to see rising number of COVID-19 infections in New Brunswick, and more people are becoming ill and needing hospitalization, particularly among young people. Les vaccins contribuent à ralentir la propagation de ce virus, et les données scientifiques et ce qui s'est passé dans d'autres pays le prouvent. Les vaccins sont cependant le plus efficaces quand ils sont utilisés en parallèle avec d'autres consignes de la santé publique qu'il faut continuer à respecter et spécifiquement jusqu'à temps que nous soyons tous vaccinés avec au moins un dose du vaccin. Le fait d'avoir reçu un vaccin semble avoir créé un faux sentiment de sécurité pour certains citoyens du Nouveau-Brunswick. Our success against COVID-19 over the next 10 weeks depends on these 4 things. Limiting the spread of more transmissible and severe variants of COVID-19, maintaining public health measures during the vaccine rollout, rapidly vaccinating as many New Brunswickers as we can, and the effectiveness of vaccines in protecting against severe symptoms, ICU admission, and death, but only when we've all had at least one dose of the vaccine will we all be protected from ICU admission, hospitalizations, and death. If you have been vaccinated, don't let that give you a false sense of security. Now, we do know that most people who are vaccinated will be protected against severe symptoms, hospitalizations, ICU admissions, and death. But remember that we won't all have one dose of the vaccine on board until at least the end of June. So there will be still a significant portion of the population that won't be vaccinated and protected against those severe outcomes. I want everybody to understand that COVID-19 will continue to pose a risk. Even after we've had our one dose, we all want to get to that 2-dose maximum protection against variants and COVID-19. People can contract COVID-19 after being vaccinated. We are getting more data every day on the transmissibility. And at this time, when we see somebody who has had a vaccine test positive for COVID, they have very, very mild symptoms or they don't have any symptoms at all. So these asymptomatic carriers can spread the virus to others who have not been vaccinated, resulting in further spread. So when we see these cases, again, we get very concerned, and we do need everybody to know that we can still get tested, we can still get vaccinated, we can still get COVID-19. After you get your vaccine, please still continue to be vigilant about watching for signs and symptoms and get tested if you have any mild symptoms. Récemment, c'est découvert qu'il y a des gens qui ont été immunisés dans d'autres pays, ils viennent au Nouveau-Brunswick et ils peuvent être encore susceptibles d'être infectés avec le COVID. Alors, c'est ça qu'on comprend et on continue à apprendre, que les gens peuvent être vaccinés et encore être positifs pour les infections de COVID-19. C'est pourquoi que nous devons tous continuer à porter un masque en public et à nous maintenir une distance au moins de 2 mètres des autres dans la mesure du possible. We all must stay home from school and work when we're not feeling well. That's why any travel that comes into our province from outside the province, outside the country, still remains risky. So if you're hosting somebody who's arriving from another country or from outside the province, you really need to be very careful about the self-isolation. Ideally, you should not be self-isolating in the same household. We all need to be watchful of symptoms of COVID-19, even those of us who have been vaccinated, and seek testing when symptoms emerge. With the emergence of more contagious variants of COVID-19, it is more important than ever that we remain on guard, and we are now in the 3rd week of the outbreak in Zone 4, which is the Edmundston-Grand Falls region. Of the 140 active cases of COVID-19 in New Brunswick, 104 are in Zone 4, mostly in the lockdown area. The Edmundston area will remain in lockdown for at least one more week, and Public Health will reassess the situation at that time. There remain a number of cases of community transmission in that area, as well as numerous incidents of public exposure to the virus. And I just want to show two slides that will demonstrate why the lockdown has to continue. So the first slide is a map that shows the cases in the lockdown area as they appeared on April the 7th. So you look at each dot and they represent a case, and the lines that are connecting them are related to other cases. And you can see three large clusters there, some smaller groups and individual cases that haven't been linked to the existing cases. There were also 13 cases that were under investigation at that time. Now fast forward to yesterday. So this next image shows the situation in lockdown as of yesterday, and we still have three large clusters of cases and a few unrelated cases outside of these groupings. We still have 19 cases which we cannot conclusively link to any of the existing clusters. There are some promising signs in the lockdown area. The number of hospital patients in intensive care in that zone has declined over the last few days. That is very, very good news. We need further evidence of improvement before ending the lockdown order. There are continuing to be new cases every day, and the contact tracing continues to be a challenge, and we're working very, very hard at protecting everyone in that community. There have been more improvements in the Grand Falls and Drummond area, and Public Health has recommended that this area move to the orange alert level effective at midnight tonight. Aujourd'hui, Santé publique confirme qu'il y a 8 nouveaux cas de COVID-19 au Nouveau-Brunswick. Il y a 4 nouveaux cas dans la zone 4. Il y a 2 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Il y a un nouveau cas dans la zone 2 qui comprend les comtés de St. John, Kings et Charlotte, et un autre dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Il y a présentement 18 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 12 aux soins intensifs. Today, Public Health has confirmed 8 new cases of COVID-19 in the province. There are 4 new cases in Zone 4, 2 new cases in Zone 1, which is the Moncton and Southeast New Brunswick area, Zone 2, which is St. John, Charlotte, Kings counties, and Zone 6, which is the Bathurst and the Acadian Peninsula, have seen 1 case today. There are 18 New Brunswickers in hospital due to COVID-19, which includes 12 who are in intensive care. Je tiens à nouveau à exprimer ma gratitude aux citoyens de la région d'Edmundston pour les efforts qu'ils continuent de déployer afin de ralentir la propagation de ce virus. La détermination dont ils continuent de faire preuve en ces temps difficiles mérite notre admiration et notre soutien. Si vos amis ou des membres de votre famille habitent dans la zone de confinement, je vous encourage à entrer en contact avec eux. Let them know that all New Brunswickers support them in this challenging time. And if you are posting anything on social media, I hope that it is something encouraging. While the lockdown continues, I want to remind the people of Edmundston that they can go out and keep their vaccine appointment or seek testing for COVID-19 when they don't feel well. It's very important that all New Brunswickers continue to seek testing when they're experiencing symptoms, particularly everyone, including people who have been vaccinated. Your own health and that of your family and friends remains at risk so long as the majority of New Brunswickers remain unvaccinated. We have a ways to go to get to the end of June so that everybody can get that first dose on board. If you feel that you have a spring cold or a mild flu, it's probably COVID-19 or one of the variants. Please get tested, even if you've been vaccinated. Given the number of cases that we have seen with no symptoms, we are expanding our testing protocols to include some asymptomatic testing. So if you have been in a location where you may have been exposed to COVID-19, we have so many public exposures that we've been publicizing, so you should seek testing even if you have no symptoms. Don't take chances with the virus, especially now, because we are assuming we are actually treating every case right now as if it is a variant of concern. Nous sommes rendus à un point dans notre lutte contre cette pandémie où nous savons tous ce que nous avons à faire, mais nous sommes peut-être exaspérés. Nous voulons tous savoir quand nous pourrons jeter ces mesures de santé publique aux oubliettes. And we want to know when we can leave our masks at home, and the answer is not yet. COVID-19 is still with us, and it will be with us for a while until we all have our one dose of the vaccine by the end of June. And at this time, we will be protected, for the most part, against ICU admissions, severe symptoms, and death. Therefore, the measures that have helped us to slow the spread of this virus up until now must remain with us as well. So we can't let up now. Whether or not you've been vaccinated, please continue to follow public health guidance and advice. Que vous ayez ou non été vacciné, continuez s'il vous plaît à suivre les conseils de santé publique. Don't assume that you are not at risk of getting COVID-19. It can happen. In the meantime, we all have to continue to protect each other, especially those who have not been vaccinated, by following public health measures. Once you are vaccinated, you will be better protected against COVID-19, but your family, friends, and neighbors may not be. Please help to be sure, as we continue through our pandemic journey, that no one is left behind. Thank you very much.
Good afternoon, bonjour. Earlier this week, the Council of Atlantic Premiers made the difficult decision to postpone the opening of the Atlantic bubble until at least May 3rd. This was not news any of us wanted to hear, but we all realized the decision was necessary. The number of new cases of COVID-19 in our province continues to rise, as do the numbers of cases caused by the UK and South African variants. It is more important than ever that we do everything within our power to slow the spread of these viruses. This is why Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health that the area in Zone 4, currently in lockdown, including Edmundston and the Upper Madawaska region, remain in lockdown under the province's mandatory order. Public Health will reassess the situation in 7 days. No travel is permitted in and out of the lockdown area or within the lockdown area except when necessary, such as for vaccinations, medical appointments, work, or to purchase essential goods. Please note that you do not need to travel to a Service New Brunswick location outside of the lockdown area to renew your license or registration. Most services offered by Service New Brunswick are available online at www.snb.ca or by calling SNB Teleservices at 1-888-762-8600. However, if you are unable to complete the service you require online or by phone, the mandatory order allows for an extension of licenses, registrations, certificates, and permits that were valid on April 9th when the lockdown began until 10 days after the lockdown ends. Also, on the advice of Public Health, the area in Zone 4, including St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls, will move to the orange alert levels under the province's mandatory order, effective at midnight tonight. For those moving to orange, restrictions are loosening a bit. Your household bubble is expanded to include 10 contacts from outside your household. Masks are mandatory in indoor public spaces as well as in outdoor public spaces when physical distancing cannot be maintained. Masks are also required when accessing food through the drive-through window. You can dine in restaurants with members of your household and your steady 10. Gyms and fitness facilities, as well as salons and spas, can open, as can entertainment centers, with the proper precautions in place. In-person services at faith venues are limited to 50 or fewer participants, depending on the size of the facility. Recreational and sports organizations may operate, but are limited to practices. While progress has been made in the Grand Falls area, the risk remains and public health guidelines must be followed. Do not travel between areas at different alert levels. Those who live in the area that is moving to the orange alert level are not permitted to travel into the lockdown area and should not travel into areas at the yellow alert level unless it is essential to do so. We know that this virus does not move on its own, so the less we move, the less opportunity there is for the virus to spread. The Saint-Quentin and Keswick regions, along with the rest of the zones in the province, will remain at the yellow alert level. I want to thank everyone for continuing to take precautions and working together to keep their loved ones and their communities healthy and safe. This pandemic has shown us how even the smallest acts, such as choosing to wear a mask, can have a big impact. Our vaccination rollout remains on schedule, and I'm proud to be able to say that we are close to having vaccinated 25% of the New Brunswick population with at least the first dose of the COVID-19 vaccine. This is an important milestone and puts us closer to a return to normal. However, as Dr. Russell has said, we must not become complacent. Even once you have received a vaccine, you must continue to follow public health rules, such as wearing a mask in public spaces and maintaining physical distancing. This will help us keep everyone safe. As well, those who are eligible for vaccines and wish to receive one should make an appointment to do so. I want to remind everyone that it is important to schedule your appointments in advance, whether they are through a pharmacy or a clinic offered by Horizon or Vitalite Health Networks. Pharmacies and clinics know in advance how much of the vaccine they will receive and book appointments accordingly to ensure that all the vaccine is administered. Because of the need to plan in advance, it could take a week or two for you to get an appointment. Please keep in mind when you are contacting a pharmacy or a clinic. If you meet the eligibility requirements for vaccination and have not yet received your vaccine, please visit gnb.ca/book-a-vaccine. People over the age of 55 are eligible to register for clinics for AstraZeneca. And if you know someone who is eligible to book an appointment and hasn't done so, reach out and make sure they know that they are eligible. If you need help booking an appointment online, If they need help booking an appointment online, please offer to help them. Or if you know someone who is unable to get an appointment because they have no way to do so, offer to drive them. Just be sure to follow the carpooling rules on physical distancing. I want to stress that we are not sitting on doses of vaccine in this province. All of the vaccine we have is spoken for. There is a process that begins when doses of the vaccine arrive in our province and are recorded as received through to when they are recorded as administered. And this process can take from 2 days up to a week. But make no mistake, any vaccine that we have in New Brunswick is accounted for in our rollout plan and will be administered to residents in a timely and efficient manner. In fact, we are accepting every dose made available to us. Recently, when the federal government indicated there were 2,500 additional doses available, and New Brunswick was eligible for 100 of them, we asked for those doses and we added them to our plan. We are making progress. We have proven that when required, we can do hard things. Be proud of what we have achieved and what each of you continue to do every day to keep your family, friends, and communities healthy and safe. You are making a difference. If you are feeling overwhelmed, please remember that you are not in this alone. Reach out and ask for the support you need. We have gotten this far by working together, and together is how we will get through these challenging times. Thank you. Merci.
Merci beaucoup. Thank you very much, Mr. Shephard and Dr. Russell. We'll now proceed to questions from members of the media. Each reporter will have one question and a very, very quick follow-up. We have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans les langues officielles de votre choix. Chaque journaliste aura une question et un suivi. Voulez-vous assurer de désactiver le son de vos micros? Travis Fortnum, Global TV.
Hi there. My question could go to either the minister or Dr. Russell. We've heard that the Edmonton area, given their tough circumstances, are going to be receiving a higher volume of vaccine. I'm just wondering if you're able to put a number on that, either a percentage of how much their vaccine doses are going to increase or actual dose numbers.
What I can confirm for you today is that the province is just under 25% vaccinated, but in the Zone 4 area, we're a full 10% above that. We're at 35.4, I think. So we have allotted as many extra doses as we can to go to that area, and I'm just looking to see if I have the numbers. No, I don't think I do. I don't have the anticipated extra numbers this week, but we do have many clinics booked for this week in all zones, including Zone 4.
Mr. Fortnum, do you have a follow-up today?
Yep. So if they're getting vaccinated at a higher rate than the rest of the province, won't that theoretically mean that they'll see lower age groups getting access to vaccines before the rest of the province, or will we just slow down the doses that get shipped to them?
Well, we've already made AstraZeneca available to 55 plus, and they have to book through the RHA clinics and pharmacy for that. But essentially, we're trying to get as many people as we can in Zone 4 vaccinated, because when we reach a higher level of percentage, we should get some help from that in severe cases. So that's the goal.
Thank you. Laura Brown, CTV.
Hi there, Minister. I'm wondering how you go about tracking. I understand for people Quebec and beyond, but for Nova Scotians and Prince Edward Islanders, how do you track them coming in and if they're isolating if we're not seeing them at the borders?
Well, anyone traveling in and out of the area is required to apply for a travel, a travel authority. And so when they come into the province, as of the date of their registration, then there will be follow-ups through public safety. Some of that's done through automated calls. I think public safety told us this week that they are endeavoring to do a minimum of one in-person visit.
Thank you. Ms. Brown, do you have a follow-up?
I'm just looking for an update on the variants. There's, I think, over 100 active cases in the Edmonton region. Are you considering all of those UK variants? And can you give us an update on the 2 South African variants that were found?
The answer to the first question around the variants in Zone 4 is yes. Most of them are UK variant, and we are presuming that all new cases are variants of concern, whether it's UK, South African, or the Brazil variant. We haven't seen the P1 variant here yet, but what I can also tell you is that so 184 cases were confirmed as variants of concern. So 180 were the UK variant, 135 cases are recovered, and 45 cases are active. And those are in Zone 1, 2, well, they're actually in all zones except for Zone 5. The South African variant, we have 4 cases, and they're all active. There are 2 in Zone 2 and 2 in Zone 3. And from March 1st to April 15th, we have confirmed the UK variant in 63% of the cases in Zone 4.
Thank you. Vicky Hogarth, CHCO TV.
Thank you, Bruce. My question is for Minister Shephard. There were exposure notifications posted yesterday for both Campobello and St. Stephen. There are just over 900 people on Campobello, many of whom cross the border regularly, either for essentials or for work or for both. Has there been any discussions about vaccinating vaccinating all eligible people on the island?
I'm going to say that public health is always considering options, and I know that the question has been put forward. We have not received any official word back on that yet. I think it's also important to note that the cases in that area are low, and so in zone 2. So I think that we need to keep following public health measures, and that we have also increased testing in the Charlotte County area. So it's really important. Public health measures work. And we've also encouraged people to travel only when they need to. So I know that Campobello has unique circumstances, but we're asking people to curtail any unnecessary travel.
Before we go to your follow-up,
Oh, I just wanted to confirm what Minister Shephard was saying about the increased capacity for testing in St. Stephen, Charlotte County.
thank you. Ms. Hogarth, your follow-up, please.
Yes, that would actually just be my follow-up. I'm just wondering what the increased testing is in the Charlotte County region.
Hang on. So the testing, we have extended hours in the locations. If I'm not mistaken, they are in pharmacy? No? Sorry, Vicki, we just need to be sure. At their testing sites that are already set up. Vicki, I apologize about that. So the testing has been increased at the testing sites and with extended hours.
Thank you.
Jean-Philippe Hughes, Radio-Canada.
Oui, bonjour. Ma question est pour Dr. Jennifer Russell. On est rendu à 3 couleurs différentes au sein de la zone 4, orange, jaune et lockdown. Est-ce que vous craignez que les gens commencent à être un peu mélangés dans cette région-là?
Non, pas nécessairement. On essaie d'avoir des rencontres avec le leadership de tous les endroits pour faire certaine que c'est clair. Numéro 1, c'est quoi la raison pour les différentes mesures en place? Pourquoi qu'on va changer les mesures et pourquoi qu'on va pas changer les mesures dans le lockdown, le confinement? Alors, c'est vraiment spécifique au niveau des risques et au niveau des nombres de cas. Alors, j'espère que les gens sont pas trop déçus avec les différentes couleurs, mais c'était vraiment pour être spécifiquement, gérer la situation au niveau des risques très spécifiquement.
Monsieur Hugues, as-tu un suivi?
Oui. Dans le cas d'une zone, justement, comme la zone 4, bon, ça fait un certain moment qu'on est aux prises avec des cas et une situation sanitaire compliquée. Est-ce que ça démontre un peu que les zones sanitaires sont peut-être un peu trop grandes, finalement, pour s'attaquer à des problèmes comme celui de l'épidémie actuelle?
Je comprends la question, je comprends tout au long du pandémie, la façon qu'on gérait les situations dans chaque zone, au niveau des hôpitaux puis les services de santé, parce que chaque zone, s'il y a trop nombreux de cas, ça va impacter le système de santé dans la zone. À ce moment-ci, à cause que l'information on reçoit maintenant sur les variants et les éclosions et comme la façon qu'on gère la situation avec le traçage de contacts étroits et la quarantaine des gens qui sont les contacts à des contacts, on a plus de confiance à ce moment-ci qu'on peut gérer la situation avec des mesures plus spécifiques dans les zones.
Merci. Savannah, Telegraph Journal.
Hi, my question's for Dr. Russell. I'm wondering if you can describe generally what kinds of transmission patterns we're seeing in the province at the moment. Is it mostly restaurants, or are we seeing spread in households, care homes? Are gatherings contributing?
Well, as you know, the highest number of cases are in Zone 4 that are active right now, and there are various different settings. There are workplace settings. There are an adult residential facility. I would say that in the red and the lockdown phase, obviously people are with their one household their one household bubble, so they would not be gathering, hopefully, in those types of situations. So I think it's, with a variant like the UK variant, it's 30 to 70% more contagious, so it is much, much easier to transmit. And the travel-related cases still continue to happen all across the province. So any of the new cases that we see are usually travel-related. We always hope that they don't spark a new outbreak in the zones that they have arrived in. And that's why the self-isolation is so important. And if you can self-isolate in a separate location, then you should do that. And the retail settings, we have seen some transmission there, and workplaces.
Ms. Odd, do you have a follow-up?
Yes, I do. Thank you, Bruce. So I guess just to confirm then, so are we seeing kind of, a lot of travel-related cases that spread a little, more so than, one case that causes a whole bunch of other cases? And I guess I'm wondering if you have an update on the cases in long-term care homes as well in Zone 4.
So in terms of the adult residential facility, we're continuing to test people. They did move them to a separate facility to allow for isolation, and that's been very helpful. And the vaccination rate in Zone 4 is higher than anywhere else. So our prompt team was activated. We're testing the residents and the staff. So 12 residents and 10 staff have tested positive already, and we're testing again today. The Roland-Long Zone 4 facility has 7 residents, and the prompt team was activated there as well. 4 residents and 5 staff have tested positive. They're going to test there again today. And in terms of, the other travel-related cases around the province, obviously we're watching them very closely. The contact tracing is extremely important. And obviously, when it's a travel-related case, we do expect people to self-isolate properly for 14 days. We expect them to not be picked up at the airport by a household member. We expect them to not make detours of any kind and run errands on their way home to their self-isolation. So this is really important for everyone, again, who is receiving or hosting a person traveling into New Brunswick from either outside the province, elsewhere in the country, or from outside the country.
Thank you. Simon Delatte, l'Acadie Nouvelle.
Oui, une question pour la ministre Shephard. Je voudrais savoir, dans la zone 4, on a une crise qui est sérieuse, qui dure, et beaucoup de personnes qui sont un peu abandonnées par le gouvernement. On a un 3e confinement, pas d'aide financière ciblée pour la région. Moi, je voulais vous demander, est-ce qu'il y aura un soutien qui est prévu pour cette région spécifiquement, un soutien financier notamment pour les entreprises?
Monsieur Delatte,
J'ai entendu une partie de la...
Monsieur Delatte, peux-tu répéter la question? Peux-tu avancer à ton micro plus fort, s'il vous plaît?
Oui, la zone 4, donc, il fait face à une crise sérieuse et qui dure, et beaucoup de personnes se sentent abandonnées par la province. On a 3e confinement et pas d'aide financière ciblée pour la région. Moi, je me demandais s'il y avait un soutien qui était prévu, un soutien spécifique pour les entreprises de la région du Haut-Madagascar et de Minnesota.
J'avais entendu la question, je peux le répéter un peu la manière que moi je l'avais compris. C'est vraiment juste le fait qu'il y a tellement de nombre de confinements dans cette zone que les entreprises sont affectées dans il y a un impact très négatif. Alors, il voulait savoir s'il y a quelque chose qui va arriver pour soutenir les gens qui ont des entreprises.
Exactement.
Yes. I can offer that Minister Dunn has been talking with some of the local leadership there in Zone 4, because we do know that through Opportunities New Brunswick, we believe that there are going to be assistance required. And so while that has not been completely defined yet, Minister Dunn is aware, as is Minister Alain, and we will be working with them.
Merci. Simon, as-tu un suivi?
Non, merci.
Merci beaucoup. Julien Lecacheur, Radio-Canada.
Oui, bonjour. Ma question est pour vous, Dr. Jennifer Russell. Dr. Russell, j'ai lu une entrevue que vous avez récemment donnée concernant les échanges dans le domaine de la santé avec l'île du Prince-Édouard, notamment qui se sont accrus depuis le début de cette pandémie. J'aimerais savoir, Dr. Russell, comment ça se passe, ces échanges avec l'île du Prince-Édouard? En gros, est-ce que l'île du Prince-Édouard pourra donner des patients au Nouveau-Brunswick s'il y a une recrudescence des cas de la COVID-19? Et vous, de votre côté, au Nouveau-Brunswick, qu'est-ce que vous pourriez demander à l'île du Prince-Édouard comme aide?
Alors, pour n'importe quelle province ou territoire au Canada, il y a une entente que s'il y a la nécessité d'avoir un échange de ressources humaines pour les situations urgentes, une demande peut être faite. Entre Nouveau-Brunswick et l'île du Prince-Édouard, la seule chose qu'on a discuté récemment, c'est que dans le cas d'un grand nombre de cas de COVID-19 nécessitant d'hospitalisation et soins intensifs, si l'île du Prince-Édouard n'avait pas de la capacité, ils envoyons des patients ici au Nouveau-Brunswick, mais ça, c'est une entente au niveau de la capacité comme telle et les patients seraient déplacés. Mais il y a aussi, comme je vous l'avais dit, une entente entre les provinces et territoires que s'il y avait de nécessité d'avoir des remplaçants pour des ressources humaines ou pour améliorer ou augmenter des situations pour des situations critiques, les demandes peuvent être faites.
M. Lecacheur, as-tu un suivi aujourd'hui?
Oui. Le Premier ministre de l'île du Prince-Édouard, Dennis King, a expliqué qu'il a parlé récemment avec le Premier ministre du Nouveau-Brunswick, Blaine Higgs, en expliquant qu'il était prêt à donner notamment des tests du côté du Nouveau-Brunswick. Est-ce que vous avez déjà fait des demandes pour récupérer, par exemple, des tests à l'île du Prince-Édouard parce que vous étiez en manque?
I'll take that one. To the best of my knowledge, no. The premiers are speaking on a very regular basis. I believe they will be speaking again next week. And to the best of my knowledge, we have not made a request of PEI for any additional test kits. I believe that at this time we have what we need, and we have a good amount of testing capacity here.
Merci, M. Lecacheur.
Merci.
Bobby Jean McKinnon, CBC.
I'll take that one. To the best of my knowledge, no. Yes, hello.
Hi, Bobby
Sorry.
Jean.
Hi. Dr. Russell, how soon do you expect the variants will overtake the original strain?
Well, New Brunswick is always a reflection of what's happening elsewhere in the country and elsewhere globally. And we know that right now the UK variant has taken over many different areas. And we get a report from Public Health Agency of Canada very regularly about which countries are affected by which variants. And we also know that here within Canada, British Columbia is dealing with the P1 variant, which is the Brazil variant. We also see some South African variant. So as of right now, the dominant variant here is UK. And in the UK, when it did take over, it took about 10 weeks, 3 months-ish, to take over. So we do expect to see that and are seeing that now. But with each progressive variant of concern that is aggressive, replacing the previous strains, again, it's hard to tell at this point in time how that's going to unfold. But again, the three most common ones that we're hearing about and seeing right now are the UK, the South African, and the Brazil. But there are others out there, and there are some yet to have evolved. So we do expect to see more mutations and more variants of concern.
Ms. McKinnon, do you have a follow-up?
Yes, I do. Thank you. Minister Shephard, New Brunswick, according to the schedule, was to receive 16,100 Moderna doses last week and 23,800 doses next week. Some other provinces are reporting delays with the Moderna vaccine. You said our vaccination rollout remains on schedule. So just to clarify, has New Brunswick not been affected by these Moderna delays?
No, we have. We've had to, we've had to pivot and push out some clinics, but essentially we are at where we thought we would be at the end of Q1 and going into Q2. So, as of April 15th this morning, we've got 157,376 people have been vaccinated with at least one dose, and that's up 6,481 since yesterday and up 35,908 over the past 7 days. So while we've had to, to pivot and make arrangements to push out some clinics, for the most part, we've been able to manage those. And, Pfizer's been very, very consistent, and we've had some additional doses of AstraZeneca that had happened, so we managed through that.
Thank you, Ms. McKinnon.
If I could you just please tell us when you do expect to receive those Moderna doses then?
Yeah, sure. There's a shipment of 16,100 doses that was scheduled for the week of April 5th, and it's arriving this week.
Thank you. John Chillibeck, Daily Gleaner.
Thanks, Bruce. There was news of a Quebec woman suffering from serious blood clots after having AstraZeneca, and now use of the Johnson & Johnson vaccine has been suspended in the United States over similar clotting fears. What would you say to New Brunswickers who are hesitant to receive one of these vaccines? AstraZeneca is available for those 55 and older, and J&J is on its way.
So, John, I've been sitting on a lot of meetings with the Special Advisory Committee, Public Health Agency of Canada, NACI, the National Advisory Committee on Immunizations, and all of the information that they've reviewed, and including, obviously recommendations from other countries. They do acknowledge that there needs to be information included in the product monograph around risks, and as long as those are communicated as of right now, we're waiting for NACI to make the next recommendation around the AstraZeneca vaccine, which we hope we'll hear about on Monday. And again, the risks, when you look at the risks of any of those reported blood clotting issues, in terms of it's a thrombocytopenia-induced thrombocytosis, and we just know that all of the vaccines protect against bad outcomes, hospitalizations, ICU admissions, and deaths. And the risk of somebody having getting COVID in Canada, having a hospital admission or an ICU admission, and ultimately dying from COVID is much, much higher than any of the risks associated with the vaccine. So that's what we're going to be messaging, that to get our province properly vaccinated, everybody needs to get one dose on board minimum between now and the end of June to protect against those bad outcomes, and ideally 2 doses to be maximally protected.
Mr. Chillibeck, do you have a follow-up?
Yes. What's the uptake been like on AstraZeneca for the 55 and older category? Are you seeing any signs of hesitancy because of some of the news out there?
My understanding is no. Minister Shephard might have heard something different, but to my knowledge, there's no wastage, there's no appointments going unfilled. All the doses that we receive are getting into arms, and it's saving lives.
Thank you. Tom Bateman, Brunswick News.
Good afternoon. I just want to build on Savannah's question about how the virus is still moving around, particularly in Zone 4, but also across the province. When I compare the active caseloads from this ongoing outbreak to the Newfoundland outbreak, which I understand was also driven by a variant, our active case count seems to be declining at a much slower rate. Can you explain that? Why? What would be different about those two cases?
Great question, Tom. Obviously, we would like it to go down much more quickly than it is. But again, different location, different situation, different combination, I guess, of components. But at this point in time, I can't really give a great hypothesis as to why, other than, I think they went to lockdown probably earlier. And again, we're trying to be the least restrictive possible with managing the COVID outbreaks to allow, an open society with education and people able to earn an income, et cetera. So our main goal is to protect our hospital system and protect it from becoming overwhelmed. So all of the steps and decisions that we make, we're with that in mind, as well as the public health components. We balance all that. We balance all the risks when we have our discussions and make recommendations to cabinet. Do I wish we were at a lower level of case counts right now? Yes, but are we managing with respect to what's happening with the hospitalized patients? That's going in the right direction. So I think I'm cautiously optimistic that we're going in the right direction. We just need a bit more time. And again, once the case count is at a certain level, to really get it down to zero, it does take time and effort and energy, and making sure that close contacts are self-isolating, et cetera, to decrease that transmission and eliminate it. We do have some community transmission, which I don't think Newfoundland had. So we have several cases that we weren't able to link to the main clusters. So I would say that that's probably contributing to it as well.
Mr. Bateman, do you have a quick follow-up?
I do, thank you. So will this inform health protocol or policy on future outbreaks? Will we move faster, for example, to go into lockdown, or will we change what a lockdown means based on what we're learning here? Thanks.
Not necessarily, Tom. I feel like the information that we have at the time that we make the decisions is very relevant, and again, I think that we do learn from every outbreak, and it might be hard to make that kind of assessment in the middle of this outbreak. It might be better to look back after it's over and see if there were things that we could do differently. Because certainly, leading up to this one, we've always utilized whatever information that we can in real time, and then looking back, if there was anything that we could tweak. We always have after-action sessions to really go over everything with a fine-tooth comb. But at this time, I feel like we're doing everything we can with the information that we have each and every day.
Thank you, Mr. Bateman. Eloise Rodriguez, Radio-Canada.
Oui, allô, ma question est pour Dr. Russell. Au début, vous avez prévenu les gens de ne pas être complaisants même s'ils sont vaccinés. Est-ce que c'est parce que vous avez remarqué un relâchement des comportements des gens au Nouveau-Brunswick?
Pas nécessairement un relâchement. Je crois que c'est une compréhension du niveau de protection que le vaccin peut leur donner 14 à 21 jours après ils sont vaccinés. Des fois, c'est la situation, c'est pas quelque chose qu'ils contrôlent. Ils sont dans une situation comme dans les résidences à soins spéciaux. L'effet d'être dans cette situation et avoir un vaccin et être en proximité des autres gens qui sont positifs pour le COVID-19, il n'y avait pas vraiment plus qu'ils ont pu faire dans une situation comme cela. Mais l'information qu'on donne aujourd'hui, c'est vraiment pour donner un niveau de compréhension avec les risques. La protection avec une dose de vaccin, c'est pas là, sauf qu'après vous avez été vacciné à moins 14 à 21 jours avant. Et le plus de protection que vous avez, c'est avec la deuxième dose et encore 2 semaines après la deuxième dose, dépendant quel vaccin que vous avez eu. Et en attendant que toute la population aient leur première dose. C'est dans ce temps-là qu'on aura toute la population, la protection au niveau de la population. À ce moment-ci, il y a encore des gens qui sont vulnérables parce qu'ils n'ont pas été vaccinés. On sait avec les variants, c'est plus contagieux, les symptômes sont plus sérieux et sévères et ça nécessite plus de gens être hospitalisés et être admis aux soins intensifs à ce moment-ci.
Mademoiselle Rodriguez, as-tu suivi?
Oui, rapidement, cette fin de semaine, vous aviez parlé de quelqu'un à l'hôpital qui avait été vacciné 2 fois, qui avait reçu les 2 doses, ça faisait plus de 2 semaines. Est-ce que vous avez un peu plus de détails? Est-ce que vous pouvez expliquer peut-être à la population comment c'est possible que quelqu'un qui est complètement immunisé se soit quand même retrouvé à l'hôpital?
Oui, alors la protection qu'on sait que c'est l'efficacité, on sait avec toutes les recherches, c'est entre 94% ou 96%, mais c'est pas 100%. Alors, si on a 100 cas, ça veut dire que même si on va avoir 4% ou 6% de la population qui ne seront pas protégés, c'est pour ça que toute la population devrait être immunisée avec 2 doses pour avoir la protection maximum pour la population, pour éviter la situation d'être hospitalisé.
Merci beaucoup. Margot Castader.
Oui, cette question est pour la ministre Shephard. Les régions qui passent au orange aujourd'hui dans la zone 4 devraient-elles avoir les élections municipales rétablies? Ou on en est où avec les élections municipales dans ces zones-là en orange actuellement?
It's my understanding that Elections NB have been given the authority to determine how to proceed or not proceed in the alert levels. I believe at Orange, I think that they're able to proceed, but we will always leave that determination up to the electoral officer.
Thank you, Minister. Merci beaucoup, Ministre. Mademoiselle Castader, as-tu un suivi?
Oui, je voulais savoir si le Nouveau-Brunswick, on avait déjà posé des questions un petit peu avant, mais est-ce que vous pensez mettre en place des incitatifs pour se faire vacciner? Par exemple, où en êtes-vous avec l'idée du passeport vaccinal?
So I can't really respond to that today. I think that the federal government is exploring options, and I guess I don't think we're anywhere near a decision on that. I couldn't comment on that today.
Merci, Margot. Adil Ibrahim, CBC.
Thank you. This question is for Dr. Russell. The variants have changed how we contact trace. Do you plan on changing self-isolation rules because of the variant as well? So, for example, extending the time of isolation for contacts of positive variant cases like Alberta has?
We did for a little while change it to 21 days, but then we looked at the data, we looked at our own information, and we decided to go back to 14 days, and we're comfortable with that. If there are different situations or circumstances that a medical officer decides to change it, it's their prerogative. But at this point in time, what we're mostly looking at is the self-isolation for people in terms of workplace settings, whether they've had 1 vaccine, 2 doses of the vaccine, et cetera. And that's going to be continually revised as we get more real-world data and data here in New Brunswick about what the risks are as more and more people get vaccinated.
Ms. Ibrahim, do you have a follow-up today?
Yes, for Dr. Russell, and if Minister Shephard, if you could chime in as well, if you have anything to add, can you walk us through what changed or what threshold was reached in the Grand Falls area that is sending it back to orange?
I think what I can offer there is that as public health is able to determine by testing, we haven't seen any increase in those areas. And so we can tell that the majority of the cases are contained to the Edmundston metropolis area. And so in trying to understand or trying to appreciate how difficult this time has been for Zone 4, we are trying to be as flexible as possible, understanding that we are cautioning against anyone in orange or yellow traveling to the Edmundston, Madawaska region where they are in lockdown. And we are stating that it is not appropriate for anyone to leave that area unless it is for the absolute most essential needs, such as essential goods.
Thank you.
Thank you. Voilà la fin de notre mise à jour. Merci beaucoup. That concludes today's update. Thank you very much.